Hi everyone. Now, beginning with fetal echocardiography, I believe that all of you must be doing already sonography, grayscale sonography, 2D sonography, and Doppler and all those anomaly scans and everything, because fetal echo is a finer thing related to anomaly scan, and the skills are needed to be better ones, right? So I hope that you are already doing ultrasonography as well, and on that basis I would not be covering the basic things related to 2D sonography or color Doppler. I will straight away be moving to fetal echo optimization. So definitely when you are doing 2D ultrasonography or when you are doing Doppler, there are certain basics which you are aware of that you have to do to adjust the machine properly and to get proper pictures and proper displays. The same thing is there for fetal echocardiography. There are certain additional points which we need to keep in mind whenever we are going to do fetal echocardiography, that these are the things which would help us to get a better display and to interpret things in a better way. So a few points before I go on to all the other things, let us just revise these few points which would be useful for us when we are doing fetal echo. First of all, try to use the highest frequency transducer if the patient is not too obese, and the reason you know pretty well that because the high frequency transducer will give us better resolution. So we need to get a high frequency transducer, because see, fetal heart is a small area and we have to see small things. So better the resolution, better it is for us. Right. The only drawback would be there when we have an obese patient. There we cannot use a higher frequency transducer. Many times you will have to you will have to use a lower one. Why? Because the penetration would be poor. So yes, obese patients and the patients with oligoamnioles, sometimes we face a problem while doing fetal echo. Otherwise, try to use the whatever the highest frequency transducer you have available with you. You can use that. Second thing is that if it is a first trimester fetus, then we can even use linear or transvaginal, because at that time the fetus is very small. Preferably transvaginal sonography is useful for fetal echo in the first trimester, but I would advise you as a beginner, start with the second trimester scans for fetal echo rather than the first trimester, because that would be a little difficult. Once you become a little expert in the second trimester scanning for fetal echo, then you can switch on to first trimester scanning also. So transvaginal can be used in second trimester also, but usually we do not require it in the second trimester, because most of the time the fetus is big enough to be seen properly in the abdominal scan. Yes, sometimes if you're doing it too early, say 16-17 weeks, then you may use a transvaginal scan to get a better view of things. Then it says activate tissue harmonics and speckle reduction. Now these two knobs are there in the machine. You must all be knowing, because it is known for people who know Doppler that what is tissue harmonics and what is speckle reduction. Practically what it will do is it will reduce the noise in the picture. So the picture will become more clear. You know, those sometimes you see when you are doing, you see those dot areas. So those are all reduced by activating the tissue harmonics and the speckle reduction imaging knobs. Then it says use a single focal zone placed in the region of the heart. Now we all know the importance of focal zone. Focal zone will give you the best, the beam is best focused in that area of the focal zone. So obviously if you will keep it in the region of the heart, it will give you a better view of the heart and you can see the heart more clearly. Right, most of the time, see, machines usually will keep it at a single focal zone, so you don't need to make those manipulations. Whenever you are going to do fetal echo, always use the preset of fetal echo available in most machines. So whenever you are starting, just start with the preset fetal echo and most of the adjustments will be done. But sometimes we need to manipulate, because depending on the patient, you know, from patient to patient, things may change. Then it says keep the depth as minimum as required. Basic point that we use even in grayscale, that your area of interest should only be on the screen and a little area beyond that. Then yes, you can use zooming here, although zooming will reduce the resolution. But nowadays, you know, the newer machines, most of them, they don't have this issue. So when you zoom the picture, normally we say that if we zoom the picture quality is going bad. But here sometimes you can use when you want to see the valve movements more clearly, or you want to see the color flows more clearly, right? Then you may use it, but only when required. Then we say reduce the beam width to improve lateral resolution. Now, what do we mean by that? That supposing we are looking at a very small heart, where the fetus is small, there what we can do is we can reduce the beam angle. You can reduce the width. You can reduce the width of the sector, the beam width, so that the beam would be more focused in the area only of the heart. Why should we look for other areas when our area of interest is heart only? So narrowing of the beam, that option is available in the machines. You can narrow the beam and you can just focus it in the area only of the heart, removing the rest of the areas. Then coming to Doppler settings. Now Doppler settings, one very important point that you have to keep in mind is the velocity range. That keep the velocity range in a proper, or PRF, what you call PRF, or velocity range proper. Because if you will keep it too low, then aliasing will come, and if you will keep it too high, obviously you will not see the color flow. And when aliasing comes, what is the problem? The problem that you will face is that you would not be able to know the flows properly. Everything will overlap. Then don't keep the color gain also very high. If you keep the color gain very high, what will happen? The color will bloom. What do we mean by blooming of color? I will just show you. So you have to prevent that blooming, otherwise it will create issues for you. So I've given you the rough PRFs that you can keep when you are looking at, like for valves, aorta, pulmonary artery, where the blood flow is faster, you can use a higher PRF, more than 60 centimeters per second. But if you want to look at IVC, the vena cava, the pulmonary veins, these are venous flows, so you can keep almost the half of it, that is 20 to 30 centimeters per second. Some places you might have to change the PRF, or you might have to change the velocity range according to the pathology that is present there, right? And the color gain, I have told you that if you will keep high color gain, what will happen? That the color will come in the solid areas also, so it may overlap the septum. So as a result, you will be missing on VSTs, you will be missing on ASTs, because the color will overlap the septum and you cannot clearly see the things. Then it says use cine loop for better assessment of valvular motion and color flows. Now I'll just tell you about this once I play the picture here. And what is dual mode? Dual mode is when you can use, like most of these machines have this dual mode. One side there is a display in grayscale, and the other side the display is in color, and both are live. So what advantage that gives you? The advantage it gives you is that supposing there is a VSD or an ASD which you would be able to see in grayscale, you can confirm that the color flow is going across that area only in the Doppler part. So as a result, simultaneously when you look at both the pictures, the correlation becomes better. Now let us just see these pictures and put across. I would try to put across the practical points that I told you. See here, for example, in this picture, if you just look at the first picture here, can you see there's a lot of aliasing, and as a result lot of overlapping of colors is going there, so it will be very difficult for you to judge regurgitations, or sometimes now here there is no stenosis as such, but you would think that because there is aliasing there is turbulence and there is stenosis, and this will give you false interpretations. It seems like the color is crossing over the septum, so you may have a false interpretation of the presence of septal defects. Now when you look here, you can very clearly see that this flow is going from the atria to the ventricle, which is red in color, and then we are seeing some blue colored flow. Maybe that flow is just returning from the wall here, and that is why it is getting reflected back, and you are seeing it in a blue shade as such, right? Then part of it, if aorta is seen, you may see a blue colored flow coming from here, but right now we can make out, see even here we can see that there's a red color flow going here into the atria, which is probably the vena cava flow, the superior vena cava flow that is going into the right atrium. So this is how you can judge that, yes, different colors, and they are different, like there is no overlapping over the septum. Like in this case it seems as if there is a VSD here, but actually there is no VSD. Fine. So these are the things that you have to keep in mind whenever you are doing the scan. Now this is what I was telling you about, that both the pictures showing, one picture is showing you the grayscale and another picture is showing you the Doppler in the same. So that way you are able to judge that, yes, this is the flow across the atrioventricular valve, yes, this is the valve here, right? Then the third thing it said, the cine loop. Now this is one of the most important things that you need to use during fetal echo, particularly to see the color flow. because regurgitations and what is the direction of the flow will definitely be seen much better when you see the cine loop. Now, what do we do in cine loop? You will freeze the picture, and in the machine you have the trackball. Just like we have the mouse here, you have the trackball, and you can go back frame by frame. See here. When you go back by frame, you can see more clearly how the color is going. Now I can see the valves are closed. Now, very clearly I can make out the closed valves, that the valves are closed. So now I am sure that this is the picture of closed valves, and this is in the systole. And then now the valves have opened up, and you can see. So you can see the closing and opening of the valves very clearly, easily, and you can judge that systole and diastole, systole, diastole, systole, diastole. You can make out, right? So this is what you can make out by using cine loop, and it becomes easy for you to judge where the color is coming from. For example, see in this picture, I can make out that this is the flow through the foramen ovale. I can make out if there would be little bit regurgitations or the VSDs, then I can make out more clearly by going step by step. So this is the value of using cine loop. It becomes useful for you when you want to judge different things in a slow motion, and you can make out very well. So these are the basic things that you should know about fetal echo when you are doing fetal echo, the basic adjustments, and keep in mind these all points are very important, otherwise you will have difficulty when you are going to do. And remember one most important thing, that whenever you are doing, there will be limitations while you are doing the fetal echo, so you might have to repeat, you might have to wait for the optimal positions to come. So with this background, now we will move on to the next part of it, that is the basic anatomy and recognizing the chambers and the vessels.